Hey, and thanks for joining us on this week's episode of For All Things Lexington, the only show dedicated to Lexington, South Carolina, and where a spade is always a spade. Here we'll talk to and about people, places, groups, things to do, and places to go in and around Lexington, South Carolina. I'm your host, Angela Barrett, and this is For All Things Lexington.
Brought to you by Lexington Aesthetics Medical Spa. Restorative and preventative treatment designed to enhance natural beauty. And by Angela Barrett at HomeMattersSC.com. Building on what matters to you.
Hey guys, and thanks for being with me this Thursday. Happy New Year. I am here today with my good friend Kristen Joyner, and we are at Lexington Aesthetics, and she is the owner and operator. And thanks for being here today, or allowing me to be with you.
Of course, thank you so much for having me. I'm so excited.
Yeah. Now, Kristen, how long have you had this open?
So we opened in April of 2022, so going on about a year and a half now.
Yeah. How did this come to be?
So oddly enough, this practice was actually supposed to be owned by another provider, and she abruptly moved away, and I was kind of able to fall into the role and kind of take over.
Oh, yeah.
And prior to that, I'd worked in aesthetics for about 5 years prior to opening Lexington Aesthetics, so it was already my passion, and then when it kind of fell into my lap to have my own business, I decided to go for it.
Yeah, because you've been doing aesthetics for a while.
Yep, since the end of 2016.
Yeah.
Yeah.
Now, how did you get into aesthetics?
So I first got an interest in dermatology and aesthetics when I was diagnosed with alopecia areata at the age of about 14, 15. It's an autoimmune hair loss condition. I lost about 50% of my hair, which you can imagine is very hard for a 14-year-old girl.
Yeah.
So I really started realizing how your appearance affects your confidence and how you present yourself. And I wanted to be able to help others in that way. When I started aesthetics, I was actually working at another small office in Lexington where I was providing knee injections, shoulder injections, kind of doing physical medicine, which I really enjoyed. And the opportunity to learn to do aesthetics was offered by my practice owner. And I was like, that sounds amazing. I would love to. So
Yeah.
got trained, started offering it there, and realized that was really, I've really finally gotten into my passion.
Yeah. Yeah. And you offer here a lot of, I'm going to call it Kardashian style, because it is kind of the latest and the greatest, and that's hard to find in our area.
It is. It is. We've really invested in our devices and all of our products. We have some of the most cutting edge lasers, the best microneedling pen, the top skincare lines as far as medical skincare is concerned. So we really wanted to bring the greatest to our patients. If I was going to do it, I'm like, we're going to do it right, and I want to offer Lexington the best.
Right. And I can honestly say that when Kristen first opened, there was a joke. I either needed an office or a cot.
We would have gladly had you.
That's right. So you guys do everything from like permanent makeup.
Mm-hmm. We do.
Skincare.
Yes.
Obviously injections, Botox type treatment, chemical pills,
microneedling,
hair removal,
laser hair removal.
So, I mean, it is, like I said, all over the board.
It is. That was one thing when I worked in a small office and I was just doing injectables. I found that my patients needed a lot more.
Right.
They needed skincare. They needed an esthetician. They needed laser, and, injectables aren't the end all be all. And to really age gracefully and look your best, I wanted to be able to offer all of the modalities.
Right. There's also a service that, I'm going to make sure, it is called the natural growth factor injections. Is that?
Yeah, so that's referring to our platelet-rich fibrin injections, where we actually draw blood from a patient, thin it out in our centrifuge, and isolate the rose gold serum part of the blood that's full of your platelets. platelets release hundreds of factors to rejuvenate and heal the body, including growth factors. So we inject those underneath the eyes for skin rejuvenation under the eyes, and then also microneedle the PRF in to get even more collagen stimulation. And it also slows healing time, or shortens healing time, which is great too.
Yeah. Because, okay, new year. So new year, new you. So several things I wanted to make sure I asked. As we get older, there are several, like you said, Botox or injections. That's not all we need.
Correct.
There are several things that happened.
Correct.
Or happen as we get older. I mean, it's just there's nothing you can do about it. It happens.
It's happening to all of us. Yeah.
Right. And one of them, like you mentioned, is you become more sunken here under the eyes, and there are other things.
Exactly.
So let's talk about that first, and then we'll sort of back up. But what are some of the things as we get older? We know Botox. Botox is everybody's friend.
Yes.
But that's not enough.
Mm-hmm.
A lot of times.
Exactly.
So tell us, as we get older, there are other things that you have that can be done to help. I mean,
Definitely. So aging, like you said, is multifactorial. Botox is going to address the wrinkles primarily in the upper third of the face, but the lower 2/3, we're losing deep fat pads, we're losing bone. And that's where dermal filler comes in to provide contour, support, rebuild some of what nature's stealing away, not give you features you never had, but restorative is the way I view it. So filler is great for the lower 2/3 of the face to rebuild the volume that you're losing.
Mm-hmm.
And then also looking at the skin, we lose collagen, we lose elastin, the skin becomes thinner, more prone to wrinkling. So laser, specifically halo, is a great way to rebuild that collagen, build elastin, and improve the overall health of your skin and improve the thickness of the skin. We also offer Sculptra. That's an injectable, one of my favorites. That is poly-L-lactic acid, and that's injected underneath the skin, and that actually builds a lot of collagen and thickens the skin in a way that dermal fillers, although injected as well, it works totally different. And that's a great way also to bring back youth to the face and address volume loss. We have to remember aging, a lot of it is volume loss. So
Right.
we want to replace some of that and also take care of the skin as well.
And some of that that you were talking about helps build back some of your natural collagen.
Exactly. And I tell people when you do Sculptra or laser, anything that's building collagen, it's like a deposit in your face 401k. You get to keep that collagen. It's yours. Your body made it. Of course, aging continues and it will break down like any of your other natural collagen, but it truly is your body replacing its own collagen, which I think is a great way to go about rejuvenating the face. Not always just using artificial products, but let your body rebuild what we can too.
Right. And, there's lots of talk about collagen these days.
Yes.
But the kind of collagen that you take, to help bones and that we take through supplements, that sort of thing, is not going to necessarily build all of that back in your face.
Correct. Definitely. There's a lot of mixed evidence on, drinking collagen powder. I tell patients, it's definitely not going to hurt you. So I think it's something worth trying. I have some patients who feel like they see a difference. Some patients may not see as much. I tell them, as long as financially it's not preventing you from investing in other skincare and procedures that we know work,
right,
I say do it. But if you're having to choose between your medical grade retinol and your collagen powder, I would say let's choose what works, the medical that we know works. Yeah, right. The retinol.
Right. And we'll get into the skincare because you have some skincare products that I absolutely love. But now I've had the halo done. So let's talk about, because I thought about that and the Sculptra. I've had the microneedling and obviously some Botox, but biggest bang for the buck, the Sculptra and the halo, I thought were hands down the best.
Yeah.
You really did see once the healing. We'll talk about that in about the ever. Yeah. But once you were done, you really did see the difference. I mean, immediately once the healing process, and that was for both of them.
Yeah.
So let's go into a little more detail about the the halo and the sculpture and exactly what happens. And again, good, bad, and ugly with any of this, whether it's filler, whether it's Botox, whether it's microneedling.
Definitely.
There is a little downtime and there is some healing. Now, some are worse, and everybody's going to be different, right?
Mm-hmm. Yeah, to an extent. We'll all kind of still medicine, so we're all going to kind of respond a little bit differently.
Right. And I guess I know with the halo, it depends on, I guess I'm going to say, the intensity of the procedure. I don't know if that's the metal, but I may not have right on it. The intensity that you choose. But so pick whichever one you want to talk about first, and let's talk about those.
Yeah.
They are great products.
Yes, we'll talk about Halo. That's my absolute favorite. And interesting fact, we're the only med spa in the Midlands that actually offers Halo.
Right.
Halo's been around for about 10 years. And even as a 10-year-old device, it continuously wins awards. It was Best Multitasking Laser for New Beauty Magazine this year. So it's just fantastic. What it is, it's actually the only technology of its type in the world. It's a dual wavelength laser. So what that means is while we're treating you, the laser is firing 2 wavelengths simultaneously. And the reason we care about that is because one wavelength is going to go to your dermis, your deeper living skin. That's where collagen fibers are. That's where a lot of our aging happens. That's where deep pigmentation is, sun damage. And then a second wavelength is going to target your epidermis, which is the top layer of your skin. It's the dead layer, but it's the visible layer. So we care about that too. That's where it can address pores, texture, superficial sun damage, also kind of overall polish the top layer of the skin so you get that beautiful halo glow everyone talks about. And the other part of it that sets it apart is that it's a fractional treatment. So what that means is the energy goes into the skin kind of like this, where it's going to spare little healthy islands of tissue around the treated area. And that's why you heal so quickly from Halo. Fully ablative lasers can carry 1 to 2 months sometimes of downtime before the skin is really healed and back to normal. And I found that for my patients, we're busy. Nobody has time for that, really.
And nobody got time for that.
They do not. They do not. So with Halo, the downtime, there is absolutely a recovery. But for the results you get, it's a relatively minimal downtime compared to other lasers on the market. And as you mentioned, us picking the intensity of it, it's a very customizable treatment. We can tailor the wavelengths independently if we want to target more fine lines and wrinkles, sun damage, pores. It's going to catch a little bit of everything, but we can really hone it in on that patient's concern and adjust how aggressive we want their treatment to be.
Right.
As well. So it's very customizable. It also measures the patient's face before treatment, or we measure with the device, and it tells us how much energy to put in per section of the face. That way we can ensure we're never under-treating a patient, but we're also not over-treating them.
Right.
It will also monitor skin temperature during the entire treatment to make sure if the skin's getting a little too warm, it will actually lower its energy on its own. It's very smart, very safe. And that was another reason I wanted to invest in that technology too.
It is a good one. And my personal experience, I think, was about complete now. And this is just because you do peel a little bit. So I'm talking about all the way to where I didn't see any peeling or flaky skin. I would say a total of 7 days. But now I was in makeup, very light makeup within 3.
Yeah, exactly.
So it wasn't terrible. It didn't, there was no hurting. There's no, burning, or maybe an hour after. It's very, like you have a really bad sunburn kind of heat. But it lasts about an hour and then zip, it was gone.
It is. And then really after that, you just kind of have that sensitivity on the skin, like you've had a bad sunburn. We've all had sunburn. So most people kind of know what to anticipate with that tenderness. But the skin always stays intact. You're never, open, majorly bloody. A little pinpoint bleeding is normal, but a lot of people think laser and they think like hamburger meat face.
Right.
There are lasers like that, and they work wonderfully, but Halo isn't one of those.
Right. And it's not like those pictures you see, the chemical peels where your face is falling off.
Yes. Yes. Not like that at all. No, it's a really well-tolerated treatment, I feel like, for patients. And it's one of my personal favorite treatments to get.
You can edit yourself. It is good money spent well. How about that? As you do see, when it's all said and done, immediate difference.
You do, and the collagen stimulation will continue even up to 2 months. So like you said, you'll see immediate results, but it only gets better and better as your body's rebuilding that collagen from Halo. And I feel like Halo's one treatment in aesthetics where one treatment makes a significant difference. A lot of other procedures like microneedling and chemical peels, they're often done in a series once a month. We love those as well. But Halo is one where a lot of patients can have one treatment, be wowed, and maybe we'll see them again next year for their kind of maintenance Halo.
Right. And that's the other thing that the good, the bad, the ugly. I mean, there is nothing that you are going to be able to do that, hey, you never have to do it again. Everything is like Botox sort of, or Botox-like products build upon each other. The more you have it done, the more maintenance you keep up with it. Eventually, probably the less and less, depending on the area, I would have to have it done. I would imagine some of these other products are the same, but you still have to come back and have it done.
You do. I mean, and that's because the aging process continues. What we're doing in the office doesn't stop aging. We're just helping patients age gracefully, improve their skin, improve their appearance, and feel their best. But because aging is constant, that's why procedures have to be repeated, or, medications like Botox wear off. So a lot of patients ask me, if I get Botox once or if I get a laser once, do I have to do it again? You don't have to. You will
to.
Yeah, even though because everybody loves it. But a lot of people worry if they do something once, it means they have to do it forever. But there is no harm in doing something once and not doing it again. But like, as you said, pretty much everybody, they want to keep up with it.
And the Sculptra.
Yes. So Sculptra is amazing. I think it's a really underutilized treatment, honestly. But I do see a trend in aesthetic medicine where we're moving a little bit more towards regenerative medicine, trying to use our own body to restore. So Sculptra, as I said, it's poly-L-lactic acid. It's owned by Galderma, which owns Dysport and Restylane. People are very friendly, usually familiar with those names.
Right.
It was actually initially approved in the 80s for HIV-related volume loss in the face.
Oh,
back when HIV medications weren't as good, patients were losing volume, or people were losing volume. They would use it to avoid patients becoming gaunt.
Right.
But now it's really moved into aesthetic medicine. So it's a powder solution. We mix it with sterile water, and it kind of looks like cloudy liquid. It's injected superficially underneath the skin, primarily through here, the temples. Those are some of my favorite areas. We lose a lot of volume here and the temples. It's a place a lot of people don't really think about. We tend to focus so much down here, but a lot of I call this the symptom of the disease, but the cause of the disease is generally, volume loss in the upper face, causing descent of tissues, and of course changes in skin. But Sculptra will replace that volume and actually help support the lower face by replacing the volume here and thickening the skin. People often notice a glow after Sculptra too. That collagen stimulation improves the skin, but also gives back volume. And Sculptra is generally done in a series, probably 4 to 6 weeks apart for each treatment, and anywhere from 1 to 3 treatments for most patients, depending on the degree of volume loss. But it's just going to help restore what, like I said, nature's kind of stolen away and keep you looking natural.
Right.
That's one thing we always want to do, is keep our patients looking natural. Our goal is not to give you features you've never had, or, inject your cheeks just because. We're really going to do a global assessment and find out what you as an individual need, where we see you've lost volume, and what's going to also give you the most bang for your buck too.
Right. And the one thing I can say about you guys, I remember when I first came, I had to go digging for a picture. She said, something around 15 years old. In other words, she wanted to make sure that, stayed true to Angela at all times. And of course, you're very conservative, and I love that anyway. But, and so, you have to do a great job of making sure something's not overdone. We've all seen those people that you're like, oh, wow, she's had lips done.
Yes, exactly. There's a lot of that out there. I tell people, you never see the good filler, you only see the bad filler. Right. Because the good filler, it should be almost undetectable.
That's right.
Mm-hmm.
Yeah. So let's talk about the neck and your chest, décolleté, and the hands. Those are other areas that
some of this can help with as well, right?
Exactly. Yeah. Necks are a very common concern in aesthetics. Like the neck often ages more than the face does, or say quicker than the face does. No. So a couple of things we can do for neck rejuvenation and also the décolleté area. Hyperdilute radius, which is similar to Sculptra. It falls in that biostimulator category, meaning to stimulate your own body to build collagen. Doing a kind of a neck wash with the hyperdilute radius. We can also do the décolleté. That will help stimulate collagen, thicken the skin. I also use Botox in the neck as well for patients who have pretty active platysmal bands, which are the bands that, if you see, you can kind of see them pop out. We can use Botox in those muscles and actually relax them, because the job of those muscles is essentially to pull down on the lower face. And we don't need anything assisting gravity, is what I say. But Botox in that area is fantastic for patients who are good candidates for it, to help smooth the neck and also sometimes minimize the appearance of jowling too once we relax those muscles. Also, some patients, will come to me, and if I don't think they're a good non-surgical candidate, I'm more than happy to refer them to plastics. If I can't help you, I'm happy to send you to where I think may help you, because a lot of the aging in the neck actually happens behind the platysma, the big muscle of the neck.
Right.
And there's really no way to reach that area non-surgically. So when I see you, I'll do an assessment and make sure that whatever, we offer here is going to be a good fit for your anatomy and where you're at in the aging process. Also, one of my favorite skincare items is the Neocutis Neck and Décolleté Cream. It's formulated for that area to have molecules that can penetrate the skin here, because the skin on the neck and chest is different than the face. So I love that there are products tailored to give you the best absorption in that area for collagen synthesis. We have vitamin C for brightening and pigmentation. Those are kind of my favorite neck treatments. Also, when we do halo, we can also halo the neck for texture and collagen. And then hands. Hands is a good one. We get asked about that a lot. Kind of my 3 favorite things for hands. Let's say 4. 1, BBL, our broadband light laser, is fantastic for cleaning up sun damage, because a lot of people feel their hands look aged because of pigment.
Right.
So we can clean up the pigment. Then also we can use filler for the hands as well. Restylane Lift is actually FDA approved for hands, and that can help with volume loss when people think their tendons are looking very exposed. The hands just look like they've just gotten thinner over time. We can use filler to replace that. It looks very natural. And then topically, I always tell my patients, put sunscreen on your hands. I mean, think about when you drive the car, all the sun exposure coming in.
Right.
Sunscreen on your hands. And then I also like retinol on the hands at night as well. Treating it kind of like the rest of the face, wanting to build collagen. Retinol will also help lighten pigmentation on the hands and, to take care of that skin as well, because most people say outside of the face, the way you can tell someone's age is their neck and their hands.
That's right.
So we don't want to neglect those areas.
Right. And talking about the skin products, so the neck and décolleté cream that you were talking about, that's really a good one.
Mm-hmm.
But one of my favorites is the little scrubby.
Oh, yes. The exfoliating polish.
Yes. Oh, my gosh. That's great.
Yes. That's one of our best sellers in the spa. Zeo is our best-selling line. Zeo is Dr. Obaji's newest line. A lot of people are familiar with Obagi skincare, like the godfather of medical-grade skincare. Zeo is his newest line with very current formulations, formulated to today's environment, today's skin. It has really addressed a wide variety of concerns for our patients. But the polish you're mentioning is fantastic. It's very smooth crystals in there, something you don't realize. A lot of over-the-counter scrubs, when they're under a microscope, St. Ives specific, it's very jagged, and it actually causes micro tears in the skin and damages the skin. So you want to use a scrub that's very, very smooth.
Right.
It also has vitamin C for brightening. A lot of people love that. And it's great to use before you're putting on your makeup. It just makes everything go on so smooth. And the exfoliation is important because as we mature, our skin cells don't turn over as quickly. So we get more of that dull, not vibrant skin. So we have to actually do some exfoliation to reveal those new skin cells underneath.
Right. Unfortunately, you can't use it every day.
Correct.
Well, I would.
Then, I know we all would, I think.
Yeah, right. And then there, the other one that I use daily is it's a tinted sunscreen.
Yes, the Skin Better.
Yeah.
navy blue.
Yes.
That's another one of our best sellers. That is one of my personal favorites. I really feel like it doubles as a BB cream almost. It gives some nice coverage, especially if you just need to run errands, kind of be out and about. Things I love about it also, it's a SPF 75. It has blue light protection. A lot of people don't realize blue lights age our skin too. And who's not in front of a blue light these days? Fluorescents, phones, computers, tablets. So all of our medical grade sunscreens will have the blue light protection. And that specific sunscreen is also mineral based. That's one of my favorite formulations versus a chemical based.
Sure.
So that's fantastic too. A little bit cleaner. And Skin Better is also fragrance free to reduce any kind of allergies with patients or little reactions with it.
And I actually wear that when I have to have a heavier cover. I mean, I do use it under, my other, what would you say?
Foundation.
More full foundation. I use it under it.
Like an extra layer of coverage, kind of just to make everything out first.
Yeah.
And
just to make sure you have the sunscreen, because like you said, who's not in front of a computer or your phone or your tablet or fluorescent lighting and all of that skin damage. And I had never thought about that.
Yeah, it's just really not widely talked about. A lot of people don't know. And our goal is to help people protect their investment. We know anything in this office, you're investing in yourself.
Right.
And we want to make sure you're taking all the necessary steps at home to protect that investment and not speed up collagen loss any faster than, natural aging. That's
Right. So I know that we talk a lot about, making yourself look better, but there are lots of things here that can help people with like scarring or acne scars or like things of that nature that, are truly bothersome. It's not just
not necessarily aging.
Not necessarily aging, right.
Exactly. So we also treat acne with our Forever Clear. Our BBL has a platform called Forever Clear, which is high-dose blue light that kills acne bacteria, reduces redness and inflammation. It's done every 1 to 2 weeks for patients. It's non-invasive, no downtime. It's a great acne treatment. We've had really good success with that from our, adolescents all the way up to some of our females who are in their 40s that almost considered going back on Accutane, but did this instead. So it's really great for all ages. Halo will address acne scarring, like you mentioned. Microneedling can also address acne scarring. That's something we see quite a bit too. So we can definitely help there. Also, rosacea and redness is something we treat too that a lot of people don't know about. BBL, again, is a fantastic treatment for reducing redness, treating broken capillaries. It'll also reduce the amount of flushing for our rosacea patients as well, as they keep up with their treatments over time. We can help with that. And was there another one you mentioned? Was it the acne?
Or just in general scarring, like...
Oh, yeah. Halo sometimes can help with scarring. Yep, the microneedling can.
Because that was one of the things we addressed with Halo. I had sun damage. Well, it was cancer, basal. And I had this huge scar, and we've done the Halo, and helped address that some, as well as some of the other lightening creams and all that. It was a great job done. Not many people could tell, but I knew it was.
Yeah, you noticed things on your face,
and that but so that I was helping address that, and did a great job too.
Yeah, we've had patients who have some cystic, they're coming in for Halo for anti-aging, but they have some scarring from maybe old cystic acne. And we've been able to actually customize Halo where that scar is and really kind of go after that scar. And people have been so happy with that as well. Yeah.
Right. Now, I know you see mostly women, but men do come.
Yeah.
When we do things, they're like, "Oh, this is for women." Right. Not really. Probably more guys should come.
They should.
Right. So what is the number one thing people come in for?
In general?
Just in general.
I would say the most common procedure is probably Botox. As you mentioned, everybody loves Botox. Yeah. That's a fan favorite. A lot of times I think of it as the gateway into aesthetics. Botox is a quick, no downtime treatment. You start seeing results in a few days. And, after treatment, you can really go back to work and do most of your normal activities. So it's a very easy, we have people pop over on their lunch hour and get their Botox. So it's just very, very lifestyle friendly.
And so if guys are looking for birthday presents, Valentine's Day presents, that's always a good one. It's a gift certificate for.
Absolutely. Absolutely. And with our gift certificates, your wife, girlfriend, mother, whoever you choose to gift can use it on anything in the spa. So you don't have to necessarily know what she wants.
Right.
We have facials if she wants to come in and just relax, be pampered, all the way up to something as transformative as Halo and kind of everything in between.
Right.
We have our gift cards online, and then we also do gift cards in the office as well. So we try to make it really easy.
Yeah.
We do a lot of gift cards for the fall and winter season.
Yes, absolutely. Now you guys are opened Monday through Friday.
Yep, 9 to 6, Monday through Friday. And then we're open every other Saturday as well, 9 to 1. Google says every Saturday. Unfortunately, there was no way for it to make it for us.
Oh, yeah.
Oddly, in 2023, Google does not have that function. Every other Saturday.
Anything else?
Yes. So every other Saturday, 9 to 1 p.m. And we do all of our treatments pretty much all days of the week. So there's not certain Halo days or certain filler days. That way we have a lot of availability for patients so they can kind of tailor it if they need a little downtime.
Yeah. Fantastic.
Yeah.
Thank you so very, very much. Let me come in today.
Much. No, it was wonderful. I enjoyed it. I really enjoyed having you. And thank you for always trusting us.
Yes, absolutely.
Your beautiful face.
Yeah. Well, guys, you've got to come in. This spa is beautiful and great people here. And they're all wonderful and kind and sweet and very flattering. Sometimes I say they need glasses.
No. You are stunning.
Yeah. Well, thanks. Thank you.
Thank you so much. It was great.
Thanks for hanging out with us today, and we hope you enjoyed the show. If you'd like to be a guest on the show or have a person, business, idea, an event that Lexington needs to know more about, email me local@forallthingslexington.com. That's the number 4, y'all.
And by Angela Barrett at HomeMattersSC.com. Building on what matters to you.